Good afternoon, everyone, and welcome to today's wonderfully afternoon with Dr. Murali Bharadwaz. Every Sunday and every Wednesday, we conduct every week a full-scale grand test for the NEETPG 2025, and we have a discussion live face-to-face at Hyderabad and also live broadcasting. So as a part of it, we give you the question paper beforehand, solve it as an online test, and you join the discussion. So, doctor, let's make the great beginning. A young child presents with intermittent severe abdominal pain with vomiting and currant jelly stools. The moment currant jelly stools are there and you are able to see the target lesion, the diagnosis is intussusception. Once more, intermittent abdominal pain, this is how a currant jelly stool looks like, which is intussusception. An older patient with acute abdominal pain and distension, coffee bean sign, this is called as, which is the feature of sigmoid volvulus. When there is a severe abdominal pain, nausea, vomiting, what you are able to see is acute mesenteric ischemia. So what is a very important finding about acute mesenteric ischemia? Signs will be, clinical signs will be very prominent, but symptoms will be, signs will not be prominent, but symptoms will be very prominent. So the symptoms which are not in measure with the like rigidity, abdominal rigidity, etc., the clinical signs of peritonitis, everything that you see, will not be there. Whereas the symptoms like abdominal pain, etc., will be disproportionately high compared to that of the clinical signs, that is acute mesenteric ischemia. Another thing is postprandial angina, abdominal angina. So the moment you eat, you require more blood supply. So the moment there is any mesenteric ischemia, it does not happen. That's the reason a pain that occurs after eating food is classical of acute mesenteric ischemia. 54-year-old female presents with a sudden severe abdominal pain. Contrast CT was presented. So what do you see here, doctor? Superior mesenteric arterial thrombosis is what is seen. An elderly patient with intermittent painless gastrointestinal bleeding and signs of anemia. So this is typically angiodysplasia, which is very common in the elderly population. Very good to see 7 online classmates. Can you please punch is the voice loud and clear for all of you, doctor? Thanks for joining on this Sunday afternoon. Every Sunday, every Wednesday, we will all meet and we have a discussion together. So now, doctor, a patient has an acute left-sided abdominal pain with rectal bleeding. Barium enema is done. So what is this called as? Fingerprinting. Can you see the bowel edema? Because the bowel edema, it looks like fingerprint sign, which is typically seen in the case of the ischemic colitis, where the bowel abdominal, the bowel has got a wall edema. Because of that, can you see thumb printing sign. Now, a premature infant with abdominal distension with bloody stool, abdominal radiograph has been done, and this is how necrotizing enterocolitis presents, especially in a premature infant is a very, very important risk factor. Nice to see Dr. Rao, Harish Rao, and many more who are all online. A patient presents with severe abdominal pain, vomiting, distension, abdominal X-ray is being done. So what do you see here, doctor? Centrally located loops which are having air fluid levels, which is classical of small bowel obstruction. A patient on routine colonoscopy, small sessile polyp is being found. So this is an example of a hyperplastic polyp where there are no dysplastic changes, unlike in adenomatous polyp. So these are all the normal glandular structure without any hyperchromatic nuclei or anything. So this is how histology of hyperplastic polyp is. A 52-year-old with multiple impacted supernumerary teeth, and history reveals multiple colorectal polyps and osteomas are present. So it is a case of Gardner's syndrome. There is a medulloblastoma history. Colonoscopy has been done where you are able to see the polyps along with medulloblastoma. So what is that called as? Turcot syndrome. Here the patient is having multiple hematomatous polyps along with hyperpigmentation periorally is an example of Peutz-Jeghers syndrome. A young patient with recurrent rectal bleeding and anemia, whenever he is passing motion, he is having that prolapsing polyp. So the mother comes to you anxiously. So it is a case of juvenile polyposis syndrome is what you need to identify. A middle-aged patient with changes in bowel habits and rectal bleeding and what is this called? Apple core sign, which is the feature of colorectal cancer. A woman in reproductive age with heavy menstrual bleeding and pelvic pain, circumscribed hypoechoic lesion in the myometrium is a case of uterine leiomyoma, where you have the spindle cells, which are very characteristic of the no way. Right? Circumscribed hypoechoic mass within the myometrium, which is showing that spindle cell morphology. A woman presents with routine pap smear, cytology is being shown. So cytology is showing dysplastic changes with hyperchromatic nuclei. That's the reason you need to do colposcopy and biopsy. 50-year-old with postmenopausal bleeding, image shows a complex ovarian mass. Histopathology is very classical of granulosa cell tumor. Granulosa cell tumors are all very rich in estrogen production. That's the reason that lead to precocious puberty, especially when it occurs in the young girls. A newborn presents with severe respiratory distress, and the intestinal gas-containing intestines are seen projecting into thorax, which is a case of congenital diaphragmatic hernia is what we need to remember. Good. A patient presents with sudden onset of complete paralysis except for vertical eye movements and blinking. So what do you see? See, this is this part. It looks like a bird, right? Can you see this structure? This is all brainstem. In this part is medulla. This belly is there, no? This is pons. And the above part is, this one is midbrain. So midbrain has a tectum, which is the roof, tegmentum, which is the floor. So here you can see the infarct in the pons. What is the importance of pons? Pons is called the center of differentiation. All motor tracts need to pass through pons. Pons is also the center for horizontal gauge. So that is the reason there is a loss of horizontal gauge and all other motor movements. The only thing left over is the vertical movement of the eye, for which the center is located in the midbrain. Midbrain is intact. So the only movement the person is, he is lying down on the bed with vertical eye movements. It is called locked up syndrome. Whenever pontine hemorrhage is there, he will have quadriplegia with loss of horizontal gaze of eyes, and the only movement left is vertical gaze is what you need to basically remember. A patient presents with progressive visual disturbances, headaches, and this is classical of a sphenoid wing meningioma, which lead to compression of the optic tract. Optic chiasma is what you need to remember. A patient presents with a gradual loss of the vision. MRI scan is showing, you can see this side normal optic nerve, this side there is a increased intensity, which is very classical of optic nerve sheath meningioma. Patient has an increased intracranial tension, visual disturbances and hormonal imbalances. So what you can see a calcified supracellular mass lesion above the cella turcica, which is classical of craniopharyngioma, which presents with visual disturbances and hormonal imbalances. A patient has headache, nausea, transient visual obscuration, very transient visual obscuration, headache and nausea. Fundoscopy is being shown, and you have treated with acetazolamide, vision returned to normal. So what is this, doctor? This is called papilledema. Ida. This is the area where your optic chiasma is sitting, no? So craniopharyngioma is supracellular. So that's the reason vertically downward compression. So here papilledema. So what is a very important rule? Patient, doctor. Patient can see, doctor can see. What will doctor will see? If he does fundoscopy, he can see papilledema. But papilledema does not lead to significant visual obscuration, only transient. So patient can see, doctor also can see. That is papilledema. Suppose if there is retrobulbar neuritis behind the retina, then patient cannot see, because optic neuritis will make vision gone. Same time, doctor cannot see because it is behind retina. So doctor cannot see, both cannot see is optic neuritis, otherwise retrobulbar neuritis. Then doctor can see, patient cannot see. If there is any papillitis, papillitis is where optic nerve inserts into the retina. That point of insertion there is inflammation. So that can be seen by the doctor. So doctor can see, patient cannot see is papillitis. Summarize. Patient can see, doctor can see. Papilledema. Patient cannot see, doctor cannot see. Optic neuritis or retrobulbar neuritis. Patient cannot see, but doctor can see is papillitis. That is what you need to remember. A 54-year-old male smoker, alcoholic with diabetes, presents with swollen eyelids, hyperemic conjunctiva, visual disturbances. He is also having tremor. So which is classical of Graves' optic neuropathy. So typically in the grave, what will happen, doctor? When will you call grave? Any thyrotoxicosis cannot be grave. Only when thyrotoxicosis with ocular signs, ophthalmopathy is there, then only it is Graves' ophthalmopathy, where there are autoantibodies. They are called LATS. They are called as long-acting thyroid stimulating antibodies, LATs. They are the ones which lead to the development of hyperthyroidism. A patient has sudden onset of visual disturbances, confusion, MRI, diffuse imaging is being done. So whenever visual disturbances are there, what is the cause, doctor? The occipital lobe primary visual cortex is located. Primary auditory cortex is located in auditory cortex. Good. Which geniculate body? Vision? Lateral geniculate body. Which colliculus is vision? Superior colliculus, sustadi. Inferior colliculus, intadi. Right? Then which olivary nucleus is vision? In the medulla? Superior olivary nucleus. And what body is associated with vision? It's a ventral fasciculus with audition. Trapezoid body is with auditory pathway, where ventral collicular nucleus is there. No, that will communicate with the opposite side, superior olivary nucleus in the medulla. Superior olivary nucleus and cochlear nucleus, they both are there in the medulla. Trapezoid body also is that fasciculus located in medulla. మీరు వచ్చారు కదా క్లాస్కి, మీకే కదా ఇంకెవరు చెప్తారు. సో ఇదేంటి occipital cortex involvement, which is bilateral posterior cerebral infarction. Will this spare macula or will it involve macula? Spare macula, because macula is supplied by both the MCA and also PCA. So whenever occipital infarction is there, there will be macula sparing blindness. Anopia will be there. Right, doc? Now, a patient has history of immunosuppression, presents with a rapid onset of vision loss and motor weakness. And MRI is showing progressive multifocal leukoencephalopathy caused by JC virus. So it is the white matter disease, leukoencephalopathy. So progressive multifocal leukoencephalopathy caused by JC virus is very common in the HIV positive individuals which are immunosuppressed. A 10-month-old infant, make mundare 200 points if I give, you prepare and come, you are giving sharp answers. So tomorrow if this habit continues, you will expect, why not 20-25 paper come to me one day before? I'll go and answer. So, yeah. 10-month-old infant, history of preterm birth, developmental delay, visual impairment. So what do you see here? This is classical of hypoxic ischemic encephalopathy. How do we know? 10-month-old infant, history of preterm birth. Preterm birth presenting with developmental delays, visual impairment because of, the only reason will be hypoxic ischemic encephalopathy. Long-term visual recognition issues follows a vascular event. MRI is taken. It has a difficulty to identify colors, faces, places, objects. So all this is whenever there is any temporal and occipital infarction. Typically you get difficulty to identify colors, faces, agnosias, places and objects. Now, a patient presents with inability to read and visual field defect where they cannot see the right in the body, right in both the eyes. Hemianopia, bitemporal hemianopia. So, typically what will he have? So, whenever there is an involvement of the splenium, it is called splenium. Then there is a development of pure alexia. Pure alexia. A patient presents with a bulging eyes, a whooshing sound in the ears, a double vision, swollen red eyes, and digital subtraction angiography is also done. So this is an example of direct carotid cavernous fistula is what you need to basically remember. A teenager presents with a persistent knee pain, which worsen in the night, palpable mass at the distal femur. So what is this called as Dr. Codman's triangle, which is the feature of osteogenic sarcoma. A child has a visible deformity near the knee and a discomfort during physical activity. Radiographs and histology is being shown. So this is what? Osteochondroma, which will be projecting up, and you can see a lot of cartilage tissue. Osteochondroma, both bone and cartilage are component of it. A patient presents with a pain in finger after a minor trauma. X-rays are being shown to you. So what do you see here? Enchondromas. Enchondromas can be part of Olier's disease and one more, Maffucci's syndrome. Maffucci's syndrome and Olier's disease. So what is the difference between the two? I already discussed in our live class. You need to do the revision. Now a patient has every NEETPG you go now, invariably one question will come in the bone tumor. There is no paper without it. One question on posterior dislocation of the hip or anterior dislocation of shoulder. One question on radial nerve, ulnar nerve, musculocutaneous nerve or median nerve or ERPS or clumkey. Ivi daati poyedilledu question. Compulsory one question will be there. Like that, there are about 1,000 topics. If you laser sharp prepare for it and know at least 20 points about each topic. Spirometry, what is residual volume, what is expiratory reservoir volume, what is FEV1 by FVC, in COPD, what it will be, restrictive lung disease, what it will be, then you should be bulldozing the bullets. Then you will become, you should reach the examiner mind. You should say, any day I am ready to bloody take a NEETPG and crack it. That's what top 100 rankers at least will have that acumen, which is not difficult to develop because I don't think they are more dedicated than you guys, at least now, at this point of life. We have given up alcohol, we have given up everything. So you should be very sure. A patient has a painful growing mass on the thigh. The lesion grows through the bone cortex. It forms a well-circumscribed mass. A biopsy has been done. So this is all the chondroid tissue. Chondrosarcoma, typically. A young adult presents with a persistent bone pain, and the bone lesion has an onion skin appearance, and it is involving the shaft, diaphyseal tumor, which is Ewing sarcoma. A young adult with the pain and swelling at the knee joint, and there is a soap bubble appearance, which is giant cell tumor of the bone. A patient has got a pain and swelling in the lower leg, right? And what do you see here? Eccentric dilatation, which is aneurysmal bone cyst. A teenager with an incidental finding on the X-ray taken after a minor sport. So this is how a non-ossifying fibroma can be found histologically. The non-ossifying fibroma. A patient has a long history of bone pain and deformity. There is a ground glass appearance of the affected bone. And also there is, what is that called? Shepherd crook deformity. which is classical of fibrous dysplasia, histologically looks like this. A patient presents with persistent pain and stiffness that improves with rest but worsens with movement. X-ray of the hip is showing completely diminished space, presence of osteophytes, which is very classical of osteoarthritis. 42-year-old with early morning stiffness with several firm masses on the elbows and heels, which is what you are able to see here, the presence of a pannus, which is classical feature of rheumatoid nodules. They are non-tender firm masses on the elbows and the heels. An infant presents with recurrent coughing spells immediately after feeding. And also there is a recurrent pneumonia. So the trachea and the esophagus are both connected with the fistula. So it is called H-type tracheo-esophageal fistula. A patient with several fingernail changes, with a recent history of unexplained weight loss and palpitations. So hyperthyroidism lead to weight loss, and also in the nail changes where the nail bed gets separated. Onycholysis is typical feature of hyperthyroidism is what you should remember. A man has a recent weight gain, particularly around the abdomen, history of blood pressure. These are all the striae, which is classical of Cushing's syndrome. Diabetes low, you metabolic syndrome low. Any high glucocorticoid levels. Abdominal striae. The patient has type 2 diabetes with the lesion on the shin. It is painful, slow to heal when injured. So this is necrobiosis lipodica diabetocorium is the classical lesion which you are able to see. A patient presents with a chronic low back pain, morning stiffness that improves with activity, increased difficulty to look straight ahead because of a stiff neck, which is very classical of ankylosing spondylitis. Occiput to wall distance is increased. Occiput to, because the ankylosing. What is the classical story of an ankylosing? We have one patient, Veerarazu. First, Veerarazu head will come into the OP. Dr. Garu, Unnara? Adi, because of the spine. Idi, at the level of the neck, cervical spine. That is a gibbous deformity. That is due to osteoporotic gibbous. Any day, little trickle also can cause a compression fracture of the vertebra. Young patient ani kaadu, it's a seronegative spondyloarthropathy, under which what are all the categories? Ankylosing spondylitis, psoriatic arthropathy, inflammatory bowel disease associated arthropathy, all this come under Besset's syndrome. They all come under seronegative spondylo. Spondylo means axial skeleton, not appendicular skeleton. Right, doc? Now, elderly patient presents with progressive pain in the legs. Radiographs show thickened bone cortices. The blood test reveal elevated alkaline phosphatase, very classical, which is feature of Paget's disease. So, 3 points you should know. High alkaline phosphatase with normocalcemia. Calcium is normal. High alkaline phosphatase, Paget's disease. normal alkaline phosphatase with hypercalcemia. No. Alkaline phosphatase normal means osteoblastic activity is normal. Osteoclastic activity is excessive. That is multiple myeloma. Because multiple myeloma, there is an osteoclastic activating factor produced and you find lytic lesions which are typically because of the osteoclastic overactivity. That's the reason they will have hypercalcemia because of the dissolution of the bone. But because their osteoblasts are not acting, alkaline phosphatase will be normal. That's the reason always the rule. Lytic lesions in the bone with normal alkaline phosphatase means immediately you should jump multiple myeloma. If you give radionuclide uptake, it will be negative in multiple myeloma even though there are lytic lesions. Because there is no osteoblastic activity. Unless osteoblastic activity is there, radionuclide uptake won't increase. So normal radionuclide uptake, normal alkaline phosphatase is the rule in case of multiple myeloma. So increased alkaline phosphatase with normal calcium levels is Paget's. High calcium with normal alkaline phosphatase is the nature of multiple myeloma. Then high alkaline phosphatase with high calcium is a feature of hyperparathyroidism. Sarpena? Next, a patient has got complaints of double vision. When you ask her to look at to the left, she exhibits nystagmus. And also, when she is looking to the left, the right eye is showing adductor lag. That's the reason which side medial longitudinal fasciculus is missing. You know internuclear ophthalmoplegia, no? Telsa internuclear ophthalmoplegia. Chepkundam malla. Oh, no. Midbrain. Once more. Siddham Setti, Harshavardhan, this part of the program is sponsored. Midbrain, pons medulla. So, central line. So, if you are looking towards the left side, this person is looking towards the left side. So left side abducens get activated. Then it will pass the information to the right side oculomotor nerve, which is there in the midbrain. Then only this eye can adduct. So suppose if there is this pathway is called as medial longitudinal fasciculus. What is it called? Medial longitudinal fasciculus. Multiple sclerosis like conditions where there is a demyelination of this path, when this eye is abducting like this, the other eye will not adduct because oculomotor nerve has no information that it need to adduct. So that is the reason there is an adductor lag. Then what will happen? A pelli koduku with internuclear ophthalmoplegia went. Pelli kuturu who is Bhagyalakshmi came. She looks like Gajalakshmi. Two Bhagyalakshmis will appear. Am I marrying one or two? He will say. So immediately what will happen? The abducted eye will say, "Oh, this guy is saying two, diplopia," and it will come and make nystagmus. So adductor lag with abducting eye coming into nystagmus is called internuclear ophthalmoplegia. But in this, which side medial longitudinal fasciculus, the side where the adductor lag is there, that side MLF is the one which is abnormal. Clear? When you say right internuclear ophthalmoplegia, right MLF is abnormal and right adductor lag will be there. White adductor lag will be there. And you may get a doubt. Sir, suppose if oculomotor palsy is there also, it won't adduct, no? When this eye is abducting, then how do you know whether it is the oculomotor nerve paralysis or oculomotor is intact but only the MLF is abnormal? Very simple. Whenever you look an object nearby, what will happen to your eyes? They both will converge. For the convergence of the two eyes simultaneously, you don't need MLF. This eye will adduct, that eye will adduct when you are looking closer object. So convergence reaction is intact, but only when abduction of the opposite eye is happening, this side eye will show adductor lag, then that is MLF. Then if convergence is not there, when you are looking object also, it remained lag, adductor lag, only this eye is saying adducting. And also when conjugate gaze is happening also, it is unable to adduct. Then that is oculomotor palsy. Ante oculomotor palsy unte convergence appudu it won't adduct. Lateral gaze of the other eye unnappudu kuda it won't adduct. Then that is oculomotor nerve problem. But here only during the time of conjugate gaze of the opposite eye only there is adductor lag, but convergence is happening normally, then that is the MLF problem. Are we clear? Super. Once more in Padmarao Nagar, you have to tuck. Hey, tell me, Ray, what is internuclear ophthalmoplegia? Which side it is? Do you know that there is an adductor lag? That time what happens when you are explaining someone, you will get confused. And when you are confused, you understood. Remember, a lot of people don't know this secret. Did you confuse in life? Did you confuse? If you confused means you are understanding. And take that confusion to clarity. Then you are a topper. So every topper need to begin with a confusion in the concepts. Until some other way, you need to find a method to clear that soup. And only the guys who logically approach subject like that will become winners. Not the one who batti maro, rata maro, oh, sab nahi chalta. They will only help to some extent, rata maro. A microbiologist observed colonies on the sheep blood agar. So, what is this appearance in Yersinia pestis lead to? Pearl. They are looking like pearls. Appearance typically. Mutyalu is Yersinia pestis, causing plague. Now, a 27-year-old with 2-year history, progressively worsening low back pain. What do you see here? Bamboo spine, which is classical of ankylosing spondylitis. A patient presents with dysphagia. What do you see? Rat tail appearance, which is classical of achalasia. And what is this called? Picture frame vertebrae. Picture frame vertebrae. Can you see? Picture frame. Pelli photo. शादी का फोटो उसका फ्रेम रहता, उसमें लड़का और लड़की रहता. So it looks like each vertebra looks like a picture frame. See, patient has ankylosing, has osteopetrosis and suffering, and we talk about marriage photo frames. Now here once more, this is a question on what is this appearance called? Coffee bean appearance, which is typical of sigmoid volvulus is what you need to remember, doctor. The patient chest X-ray is being obtained, right? So what you are able to see? You are able to see a coin lesion. Whenever coin lesion is there, you need to identify whether it is malignancy here or not by doing high resolution CT scan. Now, what do you see? This X-ray is showing you penicillin cup appearance. Arthritis mutilans is the name given for psoriatic arthritis. A child presents with barking cough, and what is this called? Steeple sign. Steeple, like a steeple sign, which is typical of croup, which is laryngotracheobronchitis. Huh? Parainfluenza virus. Whereas epiglottitis with thumb sign, Haemophilus influenza. Good. What is the characteristic sign of the nerve palsy which is being shown? So this is ulnar nerve. So claw hand deformity. Chiller question. So always remember, out of 200, 50 chiller. That's the reason we get 100. You don't prepare and go also, you get 100 marks. Ekdam Ghatiya MBBS days, you read short notes of Davidson, then you will still get 75. Because 50 will be chiller questions. Huh? So, this 100 nunchi 160 journey, doctor. For that we are now striving hard. And anyway, you know, exam paper is not for 200, it is only for 100. Because 100 chiller, anyway you will finish. Even if you every day go and have food and tea in Padmarao Nagar between 2000 students, chiller mil jayega. Huh? Even if you go to morning 9 o'clock to evening 9 p.m. Delhi wala, Mumbai wala will come and teach in Padmarao Nagar, Hyderabad also. You get a chiller, 100 marks you will get. But 100 to 160, I will show you the path. Only Dr. Murali Bharadwaz is there to show you the path to reach 100 to 160. So, doctor, but ultimately you have to read. You are going to the battle. Now, a patient is having skin lesions and these eye abnormalities. These are classical of Fabry's disease, angiokeratomas. So these are the typical features of Fabry's disease. Okay. So now, 34-year-old presents with rash in the thoracic area, severe joint pain. So she had received a medication for cardiac arrhythmias. So hydralazine, procainamide, drug-induced lupus. It is a drug-induced lupus. 58-year-old with 3-month history of rectal bleeding and recent change in the bowel habits. Whenever above 50 has a change in bowel habits, above 50 has got anemia, you have to do colonoscopy, and classically what do you see? Adenocarcinoma of the colon. A patient has a history of anorexia with soft, fine lanugo hair covering the arms and back. Typically is a feature of anorexia nervosa. Once more, doctor, anorexia versus bulimia. History of anorexia nervosa. Anorexia and bulimia. For that, every day you should come. They will tell if you come every day class. 6-year-old boy comes to pediatric clinic and there are telangiectasis and also he has a recurrent sinus infections and an unsteady gait. Ataxia, telangiectasia and recurrent sinus infections is the triad of features in Ataxia, telangiectasia. A patient has a jaundice and history of weight loss, right? History of weight loss. So how is the gallbladder, doctor? Distended. So whenever obstructive jaundice is there, when distended gallbladder is there, with weight loss is there, and what do you see? Pancreatic head ka mucinous adenocarcinoma. So what is Carvoiser's law? If it is due to malignancy, gallbladder need to be distended. If it is in a case of obstructive jaundice. If it is due to chronic cholecystitis and a biliary duct stone, then there is a shriveling of the gallbladder. So gallbladder is not distended if it is not due to malignancy, is the Carvoiser's law. A biopsy of a suspected vasculitis is being shown. So this is a classical example of fibrinoid necrosis. This is called fibrinoid necrosis in the blood vessel, which is called microscopic polyangiitis, is what you need to remember. So now, doctor, a patient has a long history of rheumatoid arthritis, presents with proteinuria, renal insufficiency. A kidney biopsy is being stained. This is what? Amyloidosis. So AL is due to multiple myeloma-like condition. Then you have the primary amyloidosis, which is AA type of amyloidosis, typically seen in chronic inflammatory conditions like rheumatoid arthritis, tuberculosis. This is a AA type of amyloidosis, which is seen in chronic inflammatory conditions. AL is seen in the case of the multiple myeloma. So all amyloidosis, what type of protein found? Dialysis associated amyloidosis is because of beta-2 globulin is the amyloid protein. Okay, list to the table we will discuss in the regular class. A biopsy from a child with a suspected vasculitis. So this is Henoch-Conlin purpura. Henoch-Conlin purpura, where there is a IgA deposition, and it is called leukocytoclastic vasculitis. If you do the histology, you can see the cytoclastic appearance of the cells. Leukocytoclastic vasculitis is Henoch-Conlin purpura. A patient has a history of sinusitis, hemoptysis. CT is being done. What is your diagnosis, doctor? So hemoptysis means upper respiratory. No, these are all vasculitic alveolar hemorrhage, which is typically seen in the case of Wegener's granulometastasis, which is also called granulometastasis with polyangiitis, upper respiratory involvement, lower respiratory involvement, renal involvement. The combination is called Wegener. So the presence of sinusitis is a feature of upper respiratory involvement. The patient has a history of asthma and sinusitis. CT scan is being shown. Asthma and sinusitis. Asthma and sinusitis. So in the CT scan, you can once more see the presence of the vasculitic alveolar hemorrhages, which is typical of eosinophilic granulomatosis with polyangiitis, also called Churg-Strauss disease. History that got asthma, sinusitis, CT scan, and one of the options is there is Churg-Strauss. Finish. You need to jump. Forget about all this. Because your ARDS will not have asthma sinusitis presentation. Pulmonary embolism cannot present like sinusitis like picture. Organizing pneumonia cannot present. So the only one which presents is this. That's simple. So the 300 hours ka video content is there, which corresponds to that 1500 pages notes, 3-volume. That you ask our guys to activate you. So, అందులో మీరు you can review the videos. Vasculitis, like important topics, you choose and then finish. In that I told all the images, story and all that. But the point is, you 100 to 160 score को जाने के लिए ये 60 का 1000 topics are there, no? In that vasculitis is one. Glomerulonephritis is one. Renal tubular acidosis is one. So, 1000 topics మీద 20 points, 20 points पकड़ो, 20,000 points पकड़े तो आपका score 100 to 160 चले जाता है. You, even I think if we do 2 tests a week, assume that if the exam is there in the June, still we have December, January, February, March, April, 5 months. 5 into 8. Weekly 2, monthly 8. 8 into 5 months. 40 tests, we finish. He will be waiting. When will exam come? Bloody, let me write it and then get 160. అలవాటు అవుతుంది. చూడంగా 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 అలవాటు అవుతుంది. Schedule of the individual subjects. We are now going in the approach of 10,000 PYQs which are miscellaneous, no? So you must be ready. See, entrance is like this. While learning driving, I asked the driver, one Ghafoor Khan was the driver who taught me. Just one day he taught. Ghafoor bhai jara ground ko leke jana pehla, I said. Ground ko? जिंदगी तमाम ग्राउंड में चक्कर मारते का चल अमीरपेट. He brought me to Amirpet first. I just got seat in Nizam's Institute, so I took a car. So it is my classmate Rukmini, who is a top neurologist in Hyderabad now. She did DNB and then neurology, DM neurology. From NIMS, she retired as professor there, and then now he is a top consultant. Murali, simple rule in driving. Whenever you are driving, no, any amount of honking done by the piche wale, don't care, you go at your own speed. If you follow that rule, you will not hit. So, a lot of people will keep 3 days anatomy, 3 days physiology. That doesn't work. You need to have an overall approach. 1000 topics, 20 points on each. Let me master. There will be 2000 classical images. I'll give you the PDF. Anyway, we use those images for the mock tests. Pathology, radiology, critical images. Totally put together, you will have 2000 images, which we need to identify, but that is not the way. History only you should identify, clinical vignette only. And you need to identify. See, commonly they will give a focal segmental glomerulosclerosis, Kimmel-Stinn-Wilson lesion, nodular glomerulosclerosis in diabetes. Like that, they will give very standard images. MIBG image of the pheochromocytoma, tram track appearance of membranoproliferative glomerulonephritis, dense deposit bone disease, electron microscopic appearance, podocyte effacement in the case of the nephrotic syndrome, like that. So totally these 2000 images, I'll give you that. एक PDF बना के I'll give you. So you follow those 2000 images regularly, done. It's not really complicated preparation. So a renal biopsy is showing proteinuria, and what is this called? Typical ribbon-like linear deposition of immunofluorescence. Linear deposition. So you want to identify good pasture based on this or this. Based on the immunofluorescence, you will identify that it is good pasture. A CT image is being shown. And what do you see here, doctor? In a case of pneumonia, there is a parapneumonic effusion. Parapneumonic effusion in a case of pneumonia. An infant is being presented. So he has a rocker bottom foot, right? Which is classical of Edwards syndrome, which is trisomy 18. 69-year-old with a history of ataxia presents with MRI scan being shown here. So how is the cerebellum, doctor? Cerebellum is a structure which will have folia. Folia means leaf-like structure is a cerebellum. Normally, this leaf-like appearance won't be seen in normal cerebellum. But if the cerebellum got degenerated, then the typical appearance will show cerebellar atrophy, cerebellar degeneration will make the cerebellum look like a leaf-like appearance, which is classical of spinocerebellar ataxia type 1 is what you need to remember. There, here the entire story is what? Another thing, how is the pons here? Crossed bun appearance. Crossed bun appearance is the one which you typically see, is very classical. Spinocerebellar ataxia type 1. Patient presents with the lesion on the arm after sustaining a puncture wound while gardening. Finish. Gardening anangane sporothrix, Shinki, which lead to lymphocutaneous sporotrichosis in the gardener. There is a fever, headache, and history of recent travel to the malaria endemic area. So, echol forms, what are they called? Echol forms in the RBC is classical of Plasmodium falciparum. A patient is having HIV, presents with respiratory symptoms with a interstitial edema, which is classical of pneumocystis carinii pneumonia. There is a history of immunosuppression presents with type 1 respiratory failure. Once more, what is type 1? What is type 2? Respiratory failure, type 1 and type 2. Both will have hypoxia. Both will have hypoxia. But type 1 will have normal CO2 and type 2 will have increased CO2. What is the difference between type 1 and type 2 respiratory failure? Both will have hypoxia, common. But type 1 will have normal PCO2, but type 2 will have increased PCO2. Why? So typically trachea become bronchi, bronchi become alveoli, alveoli are surrounded by capillaries. So whenever the pathology is there at the level of the alveolo-capillary area, oxygen cannot come in, but carbon dioxide has 40 times more diffusion capacity. So that is the reason carbon dioxide will go. But if there is any pathology at the level of the trachea or bronchi, neither oxygen can come in nor can go out. Then that is called type 2. Whereas pathology like pulmonary edema or any pulmonary fibrosis, so alveolar capillary level pathologies lead to type 1 respiratory failure with a normocapnia and hypoxia. There is hypoxia with hypercapnia is type 2 respiratory failure is what you need to remember. So chest X-ray is being shown in an immunosuppressed person. So what is this? Pneumocystis carinii. So high dose trimethoprim sulfamethoxazole need to be given. A patient has an elevated serum gastrin, undergoes somatostatin receptor scintigraphy, which is being shown here, which is how duodenal gastrinoma in Zollinger-Ellison, duodenal gastrinoma is identified by somatostatin receptor scintigraphy. 36-year-old, very nice to see 6 online classmates. Good. So 36-year-old with bleeding per rectum. Bleeding per rectum. Colonoscopy is being done. There is an abdominal pain, tenesmus. So we need to do hemorrhoidal banding and dietary fiber supplementation. So basically, all these hemorrhoids, anal fissures, they're all to do with constipation is the common denominator. Who is responsible for constipation? Zomato, Swiggy, eating burgers, eating fatty food will decrease the motility that lead to diverticular, that lead to constipation, that lead to hemorrhoids, etc. So that is the reason Avisa ginjalu, flax seeds, fry it, make it powder, put in a steel dabba, Govinda, Madhava, Madhusudana, and then 3 spoons and drink water. And this should be your advice to all your patients and also oneself. And also 1 kheera morning, 1 kheera evening. And eating papaya is a very natural way of. I think I better start a what you call YouTuber for health. Much better than this coaching program. A patient presents with the clinical features. What is this? Mucosal neuroma, slumpy, bumpy, along with medullary thyroid carcinoma, which is a feature of multiple endocrine neoplasia type B. There's a chronic cough with episodes of blood-tinged sputum, and an imaging has been done. So what is this, doctor? Cavity with a fungal ball. And in that you will see a crescent sign. A fungal ball will be there with the air shadow. With the, can you see? In this, there are air spaces. Crescent sign, which is typical of aspergilloma. A patient has a bloody diarrhea, abdominal pain, stool examination is being shown to you. So what do you see, doctor? Flask-shaped ulcer. What is important? Flask-shaped ulcer, which is classical of intestinal amoebiasis, is what you should remember. There's a gradual loss of the vision with fundoscopic examination is being shown. So this is compressive optic neuropathy with optic nerve sheath meningioma. 65-year-old with history of mesenteric ischemia with signs of abdominal pain on eating food. So what you need to do? There is a development of intestinal. Signs of abdominal pain is there, right? First you need to always do ABC. Circulation you need to restore by giving IV fluids, hypertension में जाएगा because of that. Now, patient is presents with a painless firm nodule on the eyelid that has been gradually enlarging. Nodule is not tender. So, in this case, lower eyelid, chalagion, classically. So, once more, chalagion, internal hordeolum, external hordeolum, we'll discuss in our regular class. A patient presents with the features shown in the figure. What do you see here, doctor? So this is enophthalmos. That means it has gone inside globe. Decreased sweating on the left side of the face, which is suggestive of Horner's syndrome. Elderly woman presents with sensation of the mass protruding through her vagina, pelvic pressure and urinary incontinence. So this is a third degree uterine prolapse, which is called procedentia. A postmenopausal woman presents with persistent itching and non-healing ulcer on her vulva, which is irregularly bordered on the vulva with a palpable inguinal lymph nodes, classical of carcinoma of the vulva. A postmenopausal woman with chronic itching, white patchy lesions on her vulva, which is typical of lichen sclerosis. A 6-week-old with severe muscle weakness, hypotonia from the birth, right from the birth. Marked limb and trunk weakness on ventral suspension. SMN1 gene positive, that is type 1 spinal muscular atrophy, which is called Werding-Hoffmann's disease. An infant presents with, am I too fast? We have to be, otherwise we can't. And Hemant will lock the door unless we finish 200. An infant, పట్టు వదలని విక్రమార్కుడు తిరిగి బేతాళుని దగ్గరకు వచ్చి, that is what is our manchi neni. Infant presents with inward deflection of the forefoot shortly after birth. So this is called metatarsus adductus. Metatarsus adductus. A newborn presented with the foot twisted inward and downward. So this is Talipes equinovarus. Once more, we have to read thoroughly the topic of congenital Talipes equinovarus. One of the 100 to 160 खरक्स वाला जर्नी में 100 to 160 जर्नी में CTEV हमारा साथ देगा. So what is Ponisetti method of treatment of CTEV? Depending upon the age of the patient, what is the treatment of choice? What are the various deformities in CTEV? All those are there in that 300-hour video library. Thoroughly discussed, ironed out and kept. Once more I will teach, but otherwise get an access to that. A newborn presents with a rigid flat foot, with the soles facing upward with a prominent heel. Right? There is a vertical position of the talus. This is congenital vertical talus. Actually, this should not be mentioned in the question. Already it is vertical position of talus, means answering congenital talus, vertical talus is no big, no brainer. It won't be there. Yeah. Huh? Ante, the description only is being given, no? Rigid flat foot with sole faces upward with a prominent heel. With this kind of appearance, you should identify. Right? And sometimes X-ray of this congenital vertical talus may be given. X-ray of Talipes equinovarus can be given. Already X-ray of metatarsus adductus is given. So I told you, no, 2000 images I will give you, which are classical in exam. Now question will come beyond this 2000 images, including histopathology, radiology, clinical. A older infant with a history of a rigid spine, myopathy presents with a tight hips with limited abduction, which is classical of congenital dysplasia of hip joint, dislocation of hip joint. Huh? Slipped capital epiphysis is obese child. It's a different look. Very easy question. This is different. Trintoman sign positivity. 20 points will take. Slipped femoral capital epiphysis meeda. We'll discuss it in a regular session. Now, a 2-year-old child with a notice, another thing, when you have put both the thighs, knees, one knee is at higher level than the other knee. Ortolon is, it is one of the signs. And one side, there is a prominent fold, both in inguinal area and the buttock area. A 2-year-old child with a noticeable bulge in the umbilicus that becomes prominent when crying is classical of umbilical hernia. A premature infant is presented and he is large for gestational age. There is a micrognathia, macroglossia. So this is a classical of Beckwith-Widman syndrome. Episodes of hypoglycemia are there. A newborn is presented, and what is this called? Webbing of the neck, which is the feature of Turner's syndrome, which is congenital ovarian dysgenesis. In Turner's will have normal intelligence or achondroplasia will have normal intelligence. That is a click point. Patale. So achondroplasia, Turner's will have normal intelligence in spite of the phenotypic presentation. A neonate is brought to the clinic with small white cystic lesions on the hard palate that were noticed shortly after the birth. These cysts are firm, rounded, 1 to 3 mm in size. There are some normal findings which will go away with time in a newborn. One of them is Epstein-Barr. An infant has a difficulty breastfeeding, poor latch, limited tongue mobility is an example of tongue tie, ankylosglossia. 35-year-old with painful swallowing, fever, sore throat, reddened tongue. What is this called as? Strawberry tongue appearance, which is the feature of scarlet fever caused by streptococcus. A 65-year-old male with progressive loss of vision, bitemporal heminopia, which can occur when optic chiasma is compressed from above with a pituitary adenoma. So that is all our image-based questions. We took 1 hour 13 minutes to hit 100. Next 100 questions are very fast because they're all already the story is known. So give me 3 minutes voice break. Amma? ఏంటండి ఇదైతే యూట్యూబ్లో ఉంచుతున్నాం. ఇది రైట్ నౌ బ్రాడ్కాస్టింగ్ ఇన్ టు ద యూట్యూబ్. విల్ కీప్ ఇట్ ఇన్ ద యూట్యూబ్.
Hmm.
Is it audible? So, welcome back to the session, doctor. A 40-year-old comes to the clinic with numbness and loss of taste in the anterior 2/3 of his tongue. So that is the typical distribution of the lingual nerve. There is a reduced sensation in the anterior part of the tongue, which is lingual nerve. 65-year-old male with hoarseness, difficulty swallowing and recurrent aspiration. Unilateral vocal cord paralysis with the loss of the gag reflex, which is all typical of vagus nerve injury. Recurrent aspiration. Why? Left side recurrent laryngeal nerve come from the left vagus, right from right vagus. Now, 55-year-old male with abdominal pain and distension for the past 2 days. There is a gastroesophageal reflux disease. And there is a distension of the splenic flexure and colonic obstruction. So, typically, whenever the splenomegaly occurs, it won't, even though spleen is on the left side, it won't occur into the left iliac fossa. It occur into the right iliac fossa because the presence of the phrenicocholic ligament, which will prevent it from going downwards but go towards the right side, is how the splenic enlargement occurs. So, what you are saying here, doctor, there is a T wave, immediately following that there is a U wave. That's the reason there is a biphasic wave, T wave, which is typical of hypokalemia. A 28-year-old female with muscle cramps and tingling in her hands and feet. Serum phosphate level is elevated and calcium level is decreased, which is feature of hypoparathyroidism leading to hypocalcemia. 24-year-old with progressive weakness and visual disturbances. Difficulty in balance. There is a nystagmus, hyperreflexia, nystagmus due to internuclear ophthalmoplegia. Upper motor neuron weakness because the demyelination happening in the cerebral cortex. And the optic atrophy due to the optic neuritis. And there are oligoclonal bands in the CSF, which is an important feature of multiple sclerosis, is what you have to basically remember, doctor. What is the source of glycogenolysis when you are exercising? When you are exercising, obviously the liver's glycogen is being broken down to G6P and that become converted into glycolysis and provide energy, the muscle glycogen. But the muscle glycogen does not contribute to the blood glucose because for the glycogen broken down, it becomes glucose 6-phosphate. For it to become glucose and release into the blood, you require glucose 6-phosphatase, which is the enzyme missing in muscle. So muscle is all me and myself. It will use its own glycogen for its own energy purpose, not for providing blood glucose. Blood glucose is only contributed by the liver because only liver has got that glycogen and glycogen phosphorylase. Glucose 6-phosphatase, which will break down glucose 6-phosphate into glucose and release into the blood, is what you should remember. So there is a microsatellite instability with hereditary non-polyposis colon cancer. It is a defective mismatch repair genes. There is a tachypnea, hypotonia with ketoacidosis with elevated lactate, means there is a pyruvate dehydrogenase which convert pyruvate into acetyl-CoA is missing. So all pyruvate by the action of LDH will become lactate. Hence there is a increase in lactate. There is a peripheral neuropathy, muscle weakness, irritability, seborrheic dermatitis, which is an important clue to say it is vitamin B6 deficiency. A 3-year-old boy, shortened bones, flared metaphysis, disproportionate short-limbed dwarfism, rhizomelic shortening of only the arms and legs, proximal part of the limb. Whereas their only proximal part of the forearm is normal. Forearm is normal. Thigh is short, but leg is long. So, which is typical of achondroplasia. There will be a trident-shaped fingers, prominent forehead, depressed nasal bridge, which is classical of achondroplasia. 56-year-old with flushing diarrhea, palpitations, indoleric acid levels is increased. So it is considered to be a well-differentiated neuroendocrine tumor. So what is the role of mitochondrial DNA in neuroendocrine tumor? It is the mutation of the mitochondrial DNA which is very common in the neuroendocrine tumors. And it is linked to the oxidative stress and the tumor progression. 23-year-old with a elevated HbA2, any elevated HbA2 above 3.5 is suggestive of beta thalassemia trait. Yesterday only we discussed. 45-year-old with T92 translocation. So T92 will produce a novel BCR-ABL1 fusion protein that in turn will promote the uncontrolled cell growth. In case of CML, chronic myeloid leukemia, Philadelphia chromosome. 64-year-old with recurrent urinary tract infection, mass-like lesion in the bladder wall. Michaeli-Guttman bodies are feature of malakoplakia. A palpable thyroid nodule is there. So this looks very fast if you have not done the paper. If you have done the paper and exercise your thought and waiting for a validation of the answer, then this will be good speed, correct speed. If we go slow, we cannot finish 200. That's the reason you need to solve the paper and come to the discussion. 55-year-old with a palpable thyroid nodule and FNAC is performed. Solid hypoechoic nodule with irregular margins with microcalcifications. So what do you need to do for that palpable thyroid nodular lesion? Right? You need to repeat FNAC with the ultrasound guidance is considered to be the protocol. 6-year-old with facial puffiness, abdominal swelling, found to have nephrotic syndrome with minimal change disease. What is the rule in minimal change disease? It will show a rapid response with a complete remission within 8 weeks. Is the rule of minimal change disease. 34-year-old with SLE. Huh? Does not have? Glomerulonephritis has hematuria, nephritic has hematuria, nephrotic has proteinuria, lipiduria, anasarca, venous thrombosis, etc. Then in SLE, there is a hematuria, RBC cause and diffuse proliferative glomerulonephritis with the subendothelial immune deposits, lupus nephritis. What are they called? Wire loop lesions in lupus nephritis. There you need to give high dose steroids, cyclophosphamide or mycophenolate mofetil as immunosuppression. Before you give cyclophosphamide, you need to get a consent signed. About what? You need to explain the gonadal toxicity. If you don't explain and give it later, if she want to conceive and found to have gonads gone, she will come and pick up your child and go for not taking the consent. A 48-year-old with aortic valve replacement with mechanical heart valve. Warfarin is given and INR is 3.5. What is the most important consideration in this patient? So continue warfarin therapy but maintain INR between just 2.5 to 3.5. 30-year-old fatigue, weakness, shortness of breath, and mean corpuscular volume of 70. Mean corpuscular hemoglobin 23, microcytic hypochromic means classical of iron deficiency anemia. There's a severe shortness of breath with hypoxemia after a traumatic accident with multiple fractures, bilateral infiltrates on the chest X-ray, thick layer of membranes lining the alveoli. So it is a case of fat embolism leading to acute respiratory distress syndrome. Fat embolism, not pulmonary embolism. You asked, I gave. Correct, better? So that is coagulation factor deficiency. Every NEETPG you go, this question is coming. Thromboelastography. Yesterday only I gave the list. And that PowerPoint, I think they might have uploaded into the onlinembbs.com. Yes, the entire thing is made available as a PDF. You can nicely put your... So, fresh frozen plasma. Thromboelastography shape dekh ke. Similarly, alpha angle, MA time, R time, based on that you need to decide what is the underlying type. One question definitely 100 to 160 journey mein. You can take it as my word. This is one among them. Apoptosis is another very, every exam you go, it is there. Right? So, 55-year-old man, I think we will title that book as 100 to 160 journey. Or 160 into 4, 640 marks. 160 correct answers is equal to 640. Mita 40 odileyale. 40 Govinda. What is the highest score this time? Any idea? Up to 170 people are reaching. Yes, they have a meningioma. We don't have meningioma. So we'll label the book as 180 journey. That is ambitious. People will be scared. They are all weak souls preparing for exam after 5 years of immunosuppression. So that's the reason we'll call 160. 100 to 160 book. So your score, anyway you will get without any coaching, bleaching or anything 100. But how you reach from 100 to 160 score, Dr. Murali Bharadwaz will help you. So I will identify 1000 topics into high yield topics into 20 points. So 20,000 points, single liners. And they will be typically less than 10 to 15 words in length. So if we gada point. So now a 34, where are we? 55-year-old white patch on the lateral border is leukoplakia. So it can be precancerous. Perform a biopsy. A 34-year-old audiometry is showing a dip at the 2000 hertz frequency. What is this called? Carot's notch, which is typical of otostenosis. A 45-year-old with recurrent swelling and pain in the right submandibular area, which is increasing with eating, is sialolithiasis, stone in the salivary duct. Now, 6-year-old tympanic membrane shows retracted and dull and fluid level and bubbles behind it is serous otitis media, commonly as a consequence of eustachian tube dysfunction. Chronic suppurative otitis media is
acute otitis media ki serious otitis difference.
Serious, acha. Both of them are actually I mean, acute otitis media can be serious, can be suppurative. So that's the reason this should not be the option. Actually, that's the wrong option. Agreed. So what is informed consent? It includes understanding the risks, benefits, alternatives instead of marriage. Informed consent. So in America, they also sign prenuptial agreement. शादी के पहले ही एक एग्रीमेंट होता, अगर बीबी मियाँ राजी हो तो क्या करेगा काजी. So everything is legal there. If you sleep with somebody else or I sleep with somebody else, what is the 15-day notice period? Everything. And how will be the money get separated? All those things are signed beforehand, and then prenuptial agreement. India also is reaching that point, because marriage system is almost at the verge of breakdown. Right? So 28-year-old with progressive weakness with severe abdominal pain. He reports hair loss, burning sensation, hypokalemia, proteinuria. There is some chemical powder in his workplace which is thallium poisoning. 35-year-old, trial for alleged assault. Why do you do cross-examination? Whenever any witness is presented, the defense lawyer will rip him off, saying that this fellow is a incompetent witness. If required, he will prove that he is having cataract, he did not see the murder properly. So, credibility of the witness. A 65-year-old woman is being brought, there is a injury on her hand, alleged assault. This is called defense wound. Classically, defense wound. 40-year-old woman found deceased in her apartment, fracture of hyoid bone, and typically the ligature mark is above the thyroid cartilage, which is typical of ligature strangulation. 30-year-old came to emergency in second-degree heartburns. Second-degree burns. So, start IV fluid and calculate rickets resuscitation volume based on the Parkland formula. 14-year-old comes with difficulty inserting tampons, is typically a septate hymen. 45-year-old man with severe abdominal pain, vomiting came, and surgeon failed to properly evaluate him pre and post-operatively. Is an example of criminal negligence. Criminal negligence. Therapeutic misadventure means you have given a drug like opioid or something, it led to respiratory arrest. But you have given with a good intention to save the patient, but it became a misadventure. That's okay. But here, there is a clear evidence that pre-operative evaluation, post-operative evaluation, nothing is being done, and then you operated is, or you have drunk and operated is also criminal negligence. 25-year-old with beta thalassemia major with fatigue, joint pain, abdominal discomfort, frequent blood transfusions. She has a skin pigmentation, which is transfusion-associated hemochromatosis leading to bronze diabetes. It is called skin pigmentation, diabetes with hepatomegaly. You need to give an iron chelator like deferoxamine is what you need to remember. So once more, welcome to all the online students. Thanks for joining on Sunday. So every Sunday, every Wednesday, we have a mock test paper given to you. If the exam is up to in the June, then till May. 40 mock tests. This is the 6th mock test in that series. So solve the paper. We will have a live face-to-face discussion, Hyderabad. Please come to our learning center. We love to see your faces, how they are feeling when you are being told you did wrong in the mock test. So I'll also try to arrange next mock test onwards. a 3-hour time for you to sit in the center and solve that. Then you'll get that with timer answering mood. A 28-year-old man found with gunshot wound. There's a burning of the skin, tattooing, and powder residues surrounding the entry wound. But there is no muzzle imprint. Muzzle means gun muzzle imprint is not there. So it is not contact range. It is a intermediate range pistol. In a community health center, there is a MMR vaccine which is open. There is also a multi-vial vaccine. So use the pentavalent vaccine for the infant and discard MR vaccine. According to WHO, multivalent vaccine, pentavalent vaccine, which is multi-vial, if stored properly, can be retained. Whereas in the case of the MMR vaccine, once opened, within 4 to 6 hours, it need to be finished. A researcher is conducting the case control study. So who is a control? Control should be selected independent of exposure status. Control means the one who didn't have disease. He may have similar exposure to case. He may not have similar exposure to case. Suppose you took a community, people with the lung cancer, those who did not have. But you will check how many of them are smokers, how many of them are smokers here. If you found more smokers in this, then you call smoking is responsible for lung cancer. So control must be not having lung cancer, but he may or may not have smoking history. 28-year-old presents to community health center after a successful institutional delivery. She reports Asha in her village helped her. And we have given, the patient mentions receiving 1000 INR after her delivery and the Asha receives 400 INR. This comes under Janani Suraksha Yojana. It looks like BJP is clean bowled in Jharkhand, but super top in Maha. 45-year-old from urban area comes to a community health center. So for how much population? 1,52 lakhs. Okay, sir. I will recheck this. So is the hilly area, na?
This urban area.
I'll check that. Urban health center, urban area lo pedtaru kada, hilly area lo pedtaru. You are talking about PHC.
No, sir. CHC rural areas aithe 80,000 nunchi 1 lakh 21. Ade urban areas aithe 5 lakhs nunchi.
I'll check that. This question answer we will check. 60-year-old woman has metastatic breast carcinoma. Under WHO, what are different things? You can use NSAIDs, go to stronger opioid, use an adjuvant like gabapentin. But Naru block is not part of the pain management protocol of the WHO. 45-year-old with pulmonary tuberculosis undergone DOTS therapy. After completing therapy, sputum AFB negative and culture are consistently negative for the next 2 follow-ups. Then he is declared as cured. So these definitions we should know. 100 to 160. One question on TB is waiting for you. One question on HIV and HIV drugs waiting for you. One question on streptococcus, different types, catalase positive, catalase negative, staphylococcus, streptococcus, waiting for you. 100 to 160. Good to see 10 online classmates. Very good, not bad. So in the rural community, to decrease rabies, stop vaccinating humans, but start vaccinating dogs. So that to decrease human rabies, you create herd immunity in the dogs is very important. Right? So to improve the education in standards in medical colleges, don't teach students, Teach teachers. Take teachers with real passion to teach on camera. So that's the point. Now, 60-year-old man with a history of COPD, despite living until average life expectancy age, his quality has been impacted by frequent hospitalization. Right? Which measure is most appropriate to know remaining life years adjusted for disability? That is day. What is A fiber in the nerve fiber classification? There is a susceptibility to pressure-induced conduction block. Pressure-induced conduction block. They are myelinated. But pressure does not create any susceptibility to myelination or pain transmission. Right? There will be no increased pain transmission. There is a decreased pain transmission if they are being put under pressure. They are pressure sensitive. Which radio tracer we use in PET CT, doctor? We use fluorodeoxy glucose and increased glucose metabolism in the tumor tissue. Hypertension, type 2 diabetes. So why do we use in a peripheral vascular disease case Doppler ultrasound? To know the blood flow direction and velocity in the affected artery. 54-year-old with decreased blood sounds. So what do you see here? Air bronchogram and a lobar pneumonia. What are the three types of pneumonia? Lobar pneumonia, bronchopneumonia, interstitial pneumonia. Viruses lead to interstitial pneumonia. Streptococcus is the most common cause for lobar pneumonia. And more virulent organisms lead to bronchopneumonia, where is a diffuse spread of pneumonia to both the lungs. There is a scaly erythematous plaque, pinpoint bleeding under the scale when you pluck it. That's called Auspitz sign, is the feature of psoriasis. 32-year-old women, sudden hair thinning, and typically recently she had a stress. That means it is telogen effluvium. HPV type 18 is associated with 16-18 are associated with invasive cervical cancer. There is a itchy, scaly red rash on the soles and feet. There is a septate hyphae, which is classical of Trichophyton rubrum. Melasthesia purpura lead to pityriasis, versicolor. 65-year-old with fungal ball in the cavitary lesion is Aspergillus fumigatus. A 50-year-old with uncontrolled diabetes with the white plaques on the oral mucosa. So why do you use chrome agar in Candida? So depending upon the Candida species, it will give a different color. Candida albicans gives green color. Now, 35-year-old male farmer, slow growing, swollen foot with multiple nodules, discharging sinuses. There is also a bone involvement. Filamentous bacteria is Actinomadura madure. 45-year-old, slowly progressing, verrucous lesions, wart-like crusted cauliflower appearance is typical of chromoblastomycosis. 68-year-old, abdominal pain and fever, pseudomembranous colitis. So what is the mechanism of the toxin A? It disrupts the actin cytoskeleton by glycosylating the Rho proteins, is what you should remember. 34-year-old visiting Kenya from New Delhi undergoes yellow fever vaccine. So the patient's egg allergy require caution, and the vaccine should be given in a specialized facility. Here we have quarantine hospital. Originally quarantine, it became quarantine hospital of Hyderabad. Urdu mein. So there in the fever hospital, they give a yellow 17D vaccine and then give a certificate. which you need to produce when you are going to Kenya or anywhere. 30-year-old with high fever, severe headache and rash, thrombocytopenia, elevated liver enzymes, and a rash spreading to face, palms, and soles is Rickettsia prowazekii, epidemic typhus. What is subacute form of epidemic typhus called? Brill Ginster's disease. Yesterday we discussed. Fever, sore throat, generalized lymphadenopathy, acute HIV infection. Why do we do HIV RNA PCR, doctor? See, a HIV guy, even before seroconversion, if you want to detect if he is infected, HIV RNA PCR will be done. Okay? So I got 2 times HIV needle prick and took 2 times antiretroviral therapy. First time I was putting a pigtail catheter to drain a pericardial tamponade in a HIV positive guy. Suddenly needle pricked. Panic. Running across the road, I went to opposite NIMS, Mukesh Medical Hall. So then my classmate was asking, if you take Zidovudin, bone marrow suppression. If you take Nevirapine, you will get Steven Johnson. Which one do you prefer, by the way? Huh? So I took Efavirenz. So all your friends, when you get needle prick, no, hey, come re, we will do Eliza. Udra Babu. So 40-year-old rural area of West Bengal, sheathed microfilariae with terminal nuclei. Is the clue to say it is Brugia malayi. Huh? With terminal nuclei that do not extend to the tip of, that do not extend, terminal nuclei aithe extend kavali kada antara. Yes. I'll check this part of, that's a valid point. So, regarding IgM assay in Clostridium difficile, IgM assays cannot differentiate between current and past. That's the reason only way is toxin analysis. We need to do. No serological diagnosis for Clostridium difficile. What is the mechanism of amphotericin B? It binds to ergosterol, forms spore in the fungal cell membrane. So all antifungals, their mechanism of action, echinocandins, how does fluconazole work? You need to be very sure. 42-year-old with HIV infection on antiretroviral therapy, his initial viral load was high. Then what is the main purpose of monitoring viral load in a patient taking antiretroviral therapy? To know the effectiveness of antiretroviral therapy. Then the viral load should come down. A 2-year-old boy presents to the clinic with pallor, poor growth, jaundice, elevated retic count, HbF and HbA2 elevated is beta thalassemia major. Blood transfusion? Oh no. Beta thalassemia major may, if you do electrophoresis, HbF, HbA2 will increase. That is the clue. What did you answer? When you thought as?
You know that HbF will be present beta thalassemia, HbA2 will alpha thalassemia. But blood transfusion history will be given separately. There is a beta thalassemia.
Okay. Okay.
So
a 68-year-old with ischemic heart disease with heart failure was given IV emidaron. So what does IV emidaron will do? It will decrease the ventricular rate, rapid rate control in acute atrial fibrillation. In fact, emidaron can cause hypothyroidism, can cause hyperthyroidism also. Both are possible with emidaron. So what are all the side effects of emidaron? Pulmonary fibrosis, verticillate keratopathy, blue-gray skin pigmentation, along with hypothyroidism and hyperthyroidism. Everything about amiodarone, you must be ready for the exam. You are 100 to 160 journey mein. 25-year-old, unprotected sexual contact. He is positive HBsAg, anti-HBc IgM, and negative for anti-HBs. So, acute hepatitis B infection. Yesterday we discussed what is the serological profile. మీరు ఉన్నారా yesterday? మిస్ అయ్యారా? ఆన్లైన్ ఉన్నారా లేకపోతే మధ్య మధ్యలో మూవీ హాల్లో ఇంటర్వ్యూలో బయటకు వచ్చినప్పుడు చూశాను సార్ క్లాస్. So now 30-year-old man presents to the emergency with sudden onset of high fever, muscle pain, headache, conjunctival suffusion, tenderness in calf muscle, classical of leptospira icterohemorrhagica. 68-year-old with COPD with increased shortness of breath and bicarb is 30, pH is 7.3, PCO2 is elevated. That means primarily it is respiratory acidosis with a renal compensation where kidney will try to recover the bicarb. Yesterday also we discussed this. 55-year-old says, I have the worst headache in life, subarachnoid hemorrhage. But CT was normal. Then what you need to do? You need to do MRI, brain and MR angiography and detect possible aneurysm or berry aneurysm. A rheumatoid arthritis patient is on steroid therapy with a purple striae moon face is Cushing's syndrome. ఎంత వచ్చింది స్కోర్ లెక్క పెడదాం. అది కూడా ఉండేది. ఇప్పుడు ఇద్దరే కాబట్టి యూ ఆన్సర్ ఇట్ ఆన్ OMR paper and then cross correction. 15-year-old boy with a history of rheumatic fever, mild carditis. Why do we give benzathine penicillin, doctor? To prevent the recurrence of rheumatic fever. 58-year-old with alcoholic cirrhosis. PMN count is more than 250. In the ascitic fluid is spontaneous bacterial peritoneum. When do you call secondary? If there is any perforation or any intra-abdominal catastrophe, then the peritonitis is secondary bacterial or acute bacterial peritonitis. 36-year-old with 2-week history of headache, fever, night sweats and progressive confusion. And the CSF findings show elevated protein level, low glucose and lymphocytic pleocytosis. What is that called? Tuberculous meningitis. 35-year-old woman with sudden onset of right-sided facial weakness. Inability to wrinkle the forehead means it is element type of facial nerve palsy, which is Bell's palsy. Forehead sparing will be there in upper motor neuron type of facial palsy, which occur in stroke patients. Which we call it. 65-year-old with progressive shortness of breath, absent P waves is atrial fibrillation. Shortness of breath, fixed split of the second heart sound is classical hallmark of atrial septal defect. Hypochromic RBC microcytic with low ferritin means iron deficiency anemia. Patient is tachycardic, hypotensive, dry mucous membrane. The most physiological fluid is isotonic saline. 48-year-old with asthma, nasal polyps. What is that called? Samter's triad. Asthma and nasal polyps. If given NSAIDs, why the asthma worsens? NSAID is a cyclooxygenase inhibitor. And all the pathway go into leukotriene, lipoxygenase pathway, which overproduce leukotrienes, which will lead to bronchoconstriction. 5-year-old boy, calf muscle enlargement, Gover sign is Duchenne's muscular dystrophy. 65-year-old women, elevated alkaline phosphatase, dilatation of the common bile duct, CBD dilatation is pancreatic head tumor. 32-year-old with painful raised lesions on his forearm, subcutaneous nodules. Gardening means Sporothrix If you are really good, 1 hour is enough to finish 200 questions. 3 hours is given. 1 घंटे में खत्म करना, बाहर निकलना. That precise must be your approach. 52-year-old woman, bone pain, muscle weakness, and recurrent kidney stones. Abdominal, what is that? And there is a subperiosteal bone resorption. Abdominal pain, psychic moan, primary hyperparathyroidism. 60-year-old with fatigue, frequent urination, constipation, elevated serum calcium, and a low serum phosphate is parathyroid adenoma, primary hyperparathyroidism. Are they the same history? If there is a renal failure patient means? Renal failure patient low, there will be hyperparathyroidism, which is secondary, but there it will be a renal failure. No, it is a phosphate retaining condition. So there will be typically elevated serum or normal serum with hyperphosphatemia will be classical. 57-year-old with fever, abdominal pain, malaise, 1 week after appendicectomy, localized fluid collection is there. Appendicectomy is over. Post procedure, he is having a intra-abdominal abscess, percutaneous drainage under imaging guidance. Subphrenic space is most common location for the collection, intra-abdominal abscess. 30-year-old BP 80/50, fast scan was done. So give fluid resuscitation and urgent exploratory laparotomy. Cran jelly stool is sausage-shaped mass is intussusception. For that, you give a air or contrast enema to remove the intussusceptum coming out of the intussuscipiens. Then 42-year-old with persistent drainage, pain near the anus, perianal abscess, fistula in ano. So anal fistula, fistulotomy under anesthesia. Good Saul's rule. You should know. Typically in the anal, so there is a transverse plane. Anterior to that are all straight. If they are less than 3 centimeters from the anal bulge. Posterior are all angled and curvaceous. Crohn's disease like ఎంత angle అంటే? He is using trigonometry, 30 degree. What is the sine theta? 3-month-old referred for poor feeding, vomiting, palpable abdominal mass with hydronephrosis, and there is a nephrogram which is delayed, which is classical of pelvic-ureteric junction obstruction. 4-year-old girl with a history of recurrent urinary tract infection with E. coli. Voiding cystourethrogram is being done. This is a case of vesico-ureteric reflux. A newborn delivered by cesarean section, large exposed bladder is bladder atrophy with separation of the pubic bones. Then 45-year-old diabetic with severe pain, redness, swelling, elevated WBC count is Fournier's gangrene. Necrotizing fasciitis. Then 62-year-old progressive difficulty in walking, cramping pain in the buttocks and thighs, erectile dysfunction. It is called aortoiliac occlusion disease, also called Lerith syndrome, where you have a triad of features: intermittent claudication, erectile dysfunction. So any atherosclerosis, hypertension, 30-year smoking history, all that are a risk factor for aortoiliac occlusion, right? There was a very popular advertisement also. The guy will be coming smoking. A girl will ask the lift. So he stops and gives the lift. So she sits in the car and says, he's very safe, he's a smoker. Because Constant smoking will lead to impotence. Right? So now, 34-year-old man, varicose vein surgery ke baad, he has got a numbness tingling along inner aspect of the lower limb is cephalus nerve. 35-year-old undergone motor vehicle accident, chest X-ray show left-sided pneumothorax. You need to do needle decompression followed by chest tube insertion. Hemothorax is purely you will have opacification, hemothorax. Pneumothorax ante typically there will be the lung which is compressed and all air is there in this pneumothorax. The bronchovascular markings will not be there. It will be very bald and the lung is compressed. If it is a tension pneumothorax, even mediastinal structures are pushed to opposite side. 65-year-old, painlessly, slowly growing mass in the right cheek. Pearly nodule telangiectasia is basal cell carcinoma. 72-year-old bedridden is having a decubitus ulcer, which is typically showing bone. Any bone or tendon or muscle exposure is equal to grade 4 pressure ulcer. So within 2 hours, all because of Harshavardhan and Hemant, Manchineni garu enni tappulu pettaru? చిత్రగుప్తుడి చిట్టాలో 119 correct. 119 correct. Okay, 2-3 controversies are there. Key correction under High Court law. So 119, no? By the time it is 40th test before exam, you should reach 170 is the goal. That will be a prodigious moment for me, where from 77,000 rank to 7th rank. 7 is the lucky number. Okay? Chal. Thank you very much. So tomorrow I am going to Vizag to deliver a ECG class in Geetham Medical College, John Hopkins Auditorium. I keep conducting regularly. Once I will conduct here.
Yes, sir.
So tomorrow no class, but day after tomorrow, afternoon 3 o'clock I land in Hyderabad. So evening 5 o'clock we will have a class. Right? Thank you very much for joining the session. Tell all your friends in Padmarao Nagar, in Nampalli with Murali Bharadwaz sir is the place where your scores will reach 160 and 170 marks correctly answered in NEETPG, not sitting there. Thank you.